All month long, we are observing National Stroke Month. Unusually high number of strokes here in the Scenic City area. So we turn to the expert, Dr. Tom Devlin with CHI Memorial. Dr.
Good
Devlin,
morning.
good to see you as always. Stroke Month. What do we need to know about stroke?
Absolutely. Thanks so much for having me on this morning. Look, I have three great pieces of news for our audience here this morning.
Okay.
Number one, it's important. Stroke is a really big deal. We have the highest incidence of stroke anywhere in the United States here in Chattanooga, Tennessee. So here's what you need to know. Number one piece of good news. Stroke is a very preventable disorder. 80% of strokes are entirely preventable.
Wow.
But you need to know what your risk factors are. You got to control what are called the silent killers. You need to see your doctor at least once a year. You need to make sure if you have high blood pressure that it's controlled. If you have diabetes, you need to know about it. It's the silent killer. Diagnose it, get it controlled. Don't be smoking. We all know that's a bad thing. Control your cholesterol. But then there's some other risk factors like sleep apnea. Sleep apnea causes a lot of strokes in people because the oxygen level drops at night, can cause heart attacks. So know your risk factors and get it treated, number one. The second piece of good news is that it's a very, very treatable disorder. We can give you clot-busting medicine to dissolve a clot in the brain, or we can actually take a little tiny wire, go through a little artery in your leg, go up and pull a clot out of your brain in less than 30 minutes. So it's a very treatable disorder. But the key thing, Chip, is you gotta know your sign. You have to know what the symptoms of a stroke are. There is no more time-sensitive condition in all of medicine.
Right.
So the mnemonic that we ask people to remember very simply is signs and symptoms. It's BEFAST, B-E-F-A-S-T. The B stands for if you have sudden onset of balance problems where you can't walk. E is for your eyes. If you have sudden loss of vision in one eye or both eyes. And the FAST stands for F is for face. If you develop sudden onset of facial weakness on one side. The A is if you develop symptoms of arm weakness on one side. The S is for speech. If you have sudden difficulty with either slurred speech or you can't get any words out. And the T, most importantly, is time. You lose 2 million brain cells every minute the clot is in the brain. So all you need to do is T, call 911. Don't call me, don't call you, don't call your wife or your brother, call 911. So signs and symptoms, B-E-F-A-S-T. And the third piece of good information is we have an absolutely world-class stroke center here at CHI Memorial Hospital. Get in the ambulance and tell them to take you to CHI Memorial. We have a team there all day, all night. We'll see you in 5 minutes. And let me just reassure your viewers here this morning. Just because you develop the symptoms of a stroke, it doesn't mean you're having a stroke. It may be an inner ear problem, so don't get overly concerned. It can let the professionals figure out what you have going on. So the good news is it's very preventable, it's very treatable. Just remember to go to the right place.
Absolutely, and that right place is CHI Memorial. Dr. Tom Devlin, of
Thank you
course,
very much.
Manages that entire neuroscience and neurosurgery department there. No better place to get treated for a stroke. I love you. I don't want to see you in a clinical setting.
I love you too. Good to see you.
It's good to see you as always. All right, it is 6:46. If you want to get in touch and find out more about the wonderful work they are doing at the CHI Memorial Center, all you got to do is Google them, look them up online, chimemorial.org. We'll be right back after this.